Hey, thanks for checking out this video. This video is called The Nocebo Effect. Does your brain care if you take pills? This is a companion video to my video on the placebo effect. I'm going to post them together, and they're both covering similar topics, but in opposite directions. There's some background information in my placebo video, but the bottom line is that the nocebo effect is the dark underbelly of the placebo effect. I think that the nocebo effect has existed since the dawn of human civilization, and it is why we still say, "I was scared to death," which is obviously impossible because you have to be alive in order to say it. But this concept that your brain can have a powerful effect is a recognition of this nocebo effect. If the placebo effect is the bane of drug research, the nocebo effect is the bane of modern therapeutics. We seem to never talk about the nocebo effect. No one wants to say to their patient, "Oh, it's all in your head." But the nocebo effect is a huge impediment to adherence. And adherence is one of the most important factors that limits patients being able to get the best health outcomes. This video is mainly for patients who are struggling with drug therapy, perhaps having some negative effects from it. It's also for doctors who want to develop some strategies for dealing with both placebo and nocebo effects of drug therapy. Again, part of the idea behind doing this video came out of this excellent review of placebo and nocebo effects that was published in the New England Journal of Medicine, and I would encourage you to read this if you have access to it. Your expectations of what will happen if you do something to help your health have a very powerful effect, and that is true whether it's taking a pill, undergoing surgery, doing some exercise, or eating jelly beans. Your expectation has a powerful effect on the outcome. The positive effects are the placebo effects. The negative effects are nocebo effects, and they are very common. The nocebo effect has been a source of harm for at least the last 10,000 years, and the nocebo effect is why you feel sick when I take my little voodoo doll of you and I stab it with a pin. That is why you are feeling sick. It's the nocebo, and it's been around forever. What is known about the nocebo effect is that up to about 25% of patients who are taking a pill will experience negative symptoms and will have to stop their pills because of these negative symptoms. And that is true whether what they are taking is a completely inert substance or a pharmaceutical product designed to have some beneficial effect in the patient's body. So the contemporary medical view of why we feel sick is that I give you a pill to treat your high blood pressure or a blood thinner to prevent strokes, and the pill does something in your body, and this then makes you feel sick. Most pills that we use, unless they're specifically being designed to have an effect on depression or nausea or something like that, are actually designed not to have an effect within the brain. And so when you feel unwell, you make the assumption that whatever is going on inside your body is actually then making you feel sick. It's causing you to have symptoms that are being interpreted by your brain. So the traditional medical view of why patients feel sick when receiving treatment is illustrated in this little graphic. Our patient swallows the pharmaceutical agent and something bad happens in their body. Their cartoon body turns red, indicating badness. And then that has a negative effect on the brain and the patient feels sick. Why do nocebo effects exist? Well, they exist because your body is connected to your brain. And the brain has developed a number of important early warning systems that can be activated via what we would call endogenous brain signaling chemicals, but basically, chemicals in the brain that your brain uses to warn you, to protect you before you experience harm. So, for example, if you eat bananas and you are allergic to bananas, the first time you eat a banana, it might take you a number of hours before you figure out that something has gone desperately wrong. I can tell you that the second time you eat that banana, your brain will catch some cue related to the smell or the taste of the banana, and before you know it, much earlier than the first time, you are going to know that you should not be eating this banana. That's the early warning system that the brain has developed in order to protect you. The trouble is that this early warning system also has an effect when you are taking pharmaceutical products that are designed to actually help you. What actually happens from a nocebo perspective is that our cartoon person takes an inert substance, and before it has any effect on the body, 25% of people will have an adverse effect. Their brain will tell them that there's something going on here. This is not something you should be taking. The real trouble comes when we have a patient who really needs something that is going to do a good thing within their body. It may lower their blood pressure. It may reduce the risk of having a stroke. It may treat their cancer. But their brain is telling them that, this is a bad thing. You shouldn't take this. The early warning system is set off, and you start to get negative symptoms related to that. Now, the brain is a powerful thing, and even in somebody where there's a good thing happening within the body and the brain is saying this is a bad thing, the brain chemical signaling can produce all kinds of systemic symptoms. So you can get diarrhea, you can get nausea, you can throw up, you can have horrible reactions. And it's largely because of this endogenous brain chemical signaling. I would say that nocebo effects in patients who could benefit from drug treatment account for about 1/3 of the referrals to my hypertension clinic. What is the impact of nocebo effects on my patients? Well, if I am going to use a beta blocker in a patient to treat them for their heart disease risk or their blood pressure, if I tell that patient that beta blockers are associated with erectile dysfunction, there is a 30% chance when that patient comes back to my clinic for me to review how they're feeling taking their new pill that they will report erectile dysfunction. If I don't mention the erectile dysfunction, I give them the medication. When they come back to the clinic, I specifically say, are you having any trouble with erectile dysfunction? The rate of erectile dysfunction will go down to about 15%. So it will be cut in half simply because I didn't cue that patient's early warning system to be afraid of that nocebo effect. From some studies looking at nocebos, patients who are afraid of their medications will probably have about twice as many bad reactions to taking medications than patients who are not afraid of their medication. If you think about this then, if I give the same pill with the same benefit to patients, to 4 separate patients. The first patient feels great taking it. The second patient feels great taking it. The third patient feels great taking it. The fourth patient feels rotten. So what is the difference between the pills that these 4 patients have taken? Well, there is no difference. The difference is in that fourth individual. They have exaggerated or accentuated nocebo effects to their medication. If you think that you're experiencing nocebo effects, it's worthwhile asking the question, can you change your nocebo response to medications? And I would say, yes, you can. There's lots of evidence that conditioning can have a strong effect on brain chemicals. We have to accept that every intervention that we do to ourselves, either when we, eat certain foods, take certain pills, whatever, are going to have either a placebo or a nocebo effect. But I would encourage you to consider the idea that if you have faith in the medication, that it is going to help you, that it's going to accomplish something good inside you, that will likely diminish the nocebo effect that you experience when you take the medication. Now, if you believe you're experiencing nocebo effects from your medications, you need to discuss it with your doctor, because in some cases, there is something physiologic going on within your body that's leading to you feeling unwell. And in other cases, it's a pure nocebo effect. It's worthwhile taking a step back and asking yourself whether you've had negative conditioning to taking medications, whether that's related to your upbringing, whether it's related to some unfounded social beliefs within the context that you live. But it's worthwhile asking yourself, where did my feelings about medication come from? And look at exploring some of those issues. There are ways of determining if what you're experiencing is a nocebo effect or perhaps something related to a physiologic change within your body. There's something called an N of 1 trial that we can do to try to expose what's happening. But it is worthwhile recognizing nocebo effects for what they are. I would encourage you to leave comments below if you think this is intriguing. If you have other ideas about managing nocebo effects, or if if you know of good information about placebo effects, you want to leave it in the comments below. I'll try to collate the comments. If you have ideas for other videos, please leave a comment. Thanks so much for watching this video. I hope you found it interesting.
Dr. Dresser does not wish to take any responsibility for his opinions expressed in this video. Nothing in this video should be considered a therapeutic or diagnostic recommendation. If you are one of Dr. Dresser's patients and wish to be considered a good one, please adhere to everything in this video with religious fervor. If you are not one of Dr. Dresser's patients, please discuss these ideas with your healthcare provider.